Okay, we're going to do a little cosmetic spider vein treatment on these telangiectasias. They're very small little red veins. There's no evidence here of deep vein problems, so we don't get an ultrasound or anything. We just talk to people about this and give them an estimated number of treatments they might require. We always tell people never expect just one treatment. It's going to at least be 2 or 3 treatments, and sometimes even a few more than that, because as you inject these, you see them disappear, but then they don't completely stay away. I tell people half will stay gone and half will still be there, and you come back and you treat it again and you'll get the next half. So it takes a few treatments. They tend to look a little worse after they treat. Immediately they just look red and inflamed, and then you'll come back and some of the larger ones might have a little clotted vein in it. Not any kind of dangerous clot or anything like that. It just means the blood's trapped in there, and that makes them look a little darker, and then that just has to be slowly absorb over a month or two. So when I inject, what I frequently do is actually pull back just slightly so there's a little air in the tip of the hub here. So your first injection is actually a slight, very small amount of air. And what that does is the air clears the blood out, and then the sclerosant hits it. So it makes it a more effective contact of pure sclerosant with the solution. The spider veins is a relatively simple process. Usually come in for just a screening, so we like to check on what your health status is, make sure there's nothing to concern. If there's any evidence of venous insufficiency, we might recommend an ultrasound before having treatment. But most part, there's somebody with straightforward spider veins like this just come in, get a screening, and then we schedule them for treatment. That way all their questions are answered before they start the process and kind of know what to expect. The actual treatment just takes really a few minutes, 10 to 15 minutes at the most. Sometimes we go a little longer, but not usually. And then we continue to see everybody every couple of weeks till we finish the treatment, sometimes stretching it out a little longer between sessions to let things fade. But overall it goes just like this, just quite simple and easy.